Tigecycline is a medication that is used to treat specific severe bacterial infections that other antibiotics may not be able to treat. It belongs to a group of drugs called tetracycline antibiotics, and it works by preventing the growth of bacteria. It's important to note that this medication only treats bacterial infections and will not work for viral infections, such as the common cold or flu. Using this antibiotic when it's not necessary can cause it to be ineffective for future infections. Before using tigecycline, make sure to read the patient information leaflet from your pharmacist. This medication is given through an injection into a vein by a healthcare professional. Your doctor will determine the dosage based on your condition, and it is usually given every 12 hours. If you are using this medication at home, make sure to learn the preparation and usage instructions from your healthcare professional. Remember to use this antibiotic at the same times every day for the best effect. Also, continue to use this medication until the full prescribed amount is finished, even if your symptoms disappear. And don't forget to tell your doctor if your condition lasts or gets worse. You may experience nausea, vomiting, headache, dizziness, or pain/swelling at the injection site. If any of these effects persist or worsen, inform your doctor or pharmacist promptly. Remember, your doctor has prescribed this medication because they believe the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, seek medical attention if you experience signs of kidney problems, unusual fatigue, severe stomach/abdominal pain, hearing changes, irregular heartbeat, easy bleeding/bruising, yellowing of the eyes or skin, dark urine. Tigecycline may rarely cause increased pressure around the brain, especially for women of childbearing age who are overweight or have had intracranial hypertension in the past. Seek immediate medical help if you experience severe or persistent headaches, nausea/vomiting, or vision changes. This medication may also rarely cause a severe intestinal condition due to a bacteria called C. difficile. Contact your doctor if you develop persistent diarrhea, abdominal/stomach pain, or blood/mucus in your stool. Do not use anti-diarrhea or opioid products as they may make symptoms worse. Prolonged use of this medication may result in oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. Seek immediate medical help if you notice symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. And remember, this is not a complete list of possible side effects. Contact your doctor or pharmacist for any other unlisted effects. This medication has the possibility of increasing the risk of death. It is recommended to only use this medication when other treatments have not been effective. It is important to talk to your doctor about the risks and benefits of using this medication, and to consider other effective and possibly safer treatments for your infection. Before using tigecycline, it's important to talk to your doctor or pharmacist if you have any allergies, as this product may contain ingredients that can cause allergic reactions. Also, make sure to let them know if you have a history of liver disease. Be careful when taking this medication, as it may make you feel dizzy, especially when combined with alcohol or marijuana. Additionally, tigecycline may affect the effectiveness of certain vaccines, so be sure to inform your healthcare professional before getting any immunizations. This medication may also make you more sensitive to the sun, so be sure to limit your time in the sun and use sunscreen. If you're pregnant or breastfeeding, talk to your doctor before using tigecycline. And if you're planning on having surgery, make sure to let your doctor or dentist know about all the medications you're taking. Lastly, if you have children under the age of 8, be aware that they may be more sensitive to the side effects of tigecycline, including tooth discoloration. It's important to be aware of potential drug interactions with Tigecycline Vial, as they can affect how your medications work and increase the risk of serious side effects. This list doesn't cover all possible interactions, so it's crucial to keep a record of all the products you use and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with Tigecycline Vial are retinoid medications taken by mouth, such as acitretin and isotretinoin. If someone takes too much Tigecycline Vial and has severe symptoms like fainting or difficulty breathing, call 911. Otherwise, contact a poison control center immediately. U.S. residents can call their local poison control center at 1-800-222-1222, and Canadian residents can call a provincial poison control center. It's important not to share this medication with anyone else. It has been prescribed specifically for your current condition, so don't use it for another infection unless your doctor instructs you to. Your doctor may also want to perform lab and/or medical tests while you're using this medication, so make sure to attend all scheduled appointments and consult your doctor for more information. Make sure to take each dose of Tigecycline Vial at the scheduled time. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. Be sure to follow the storage instructions provided with the Tigecycline Vial, and keep it out of reach of children and pets. Do not dispose of the medication by flushing it down the toilet or pouring it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, be sure to properly discard it with the guidance of your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.